Hi, this is David Nevins on Citybiz List, and our guest today is Dan Blum, who is about a year into his tenure as, I guess I can still say, the new president of Sinai Hospital. So Dan, I guess I'm not sure how much our viewers know about Sinai Hospital. It's this mammoth, important institution that's been around for a long time. So give us a little bit to begin, I guess I'd say the elevator speech about all the good works going on at Sinai.
Sure. Once again, David, thank you very much for inviting me as your guest today. It really is a privilege to be here. I've been here, in fact, since April, so not quite a year, still a few months to go. And I'm still learning every day. Unfortunately, I arrived here, during the pandemic at a time when the pandemic was still relatively new. Things were very much locked down. And so the arrival experience and my experience in getting to know the community and the institution is very different from what I anticipated and what would normally be the case when you start one of these roles. That said, I joined the institution because it is quite impressive. I came here from New York, which is not at a loss for impressive healthcare institutions. And I would say, the needs of the greater Baltimore community, the Maryland communities that we serve, as well as the history and potential of Sinai and the LifeBridge Health System, they both drew me here from New York. Sinai Hospital has a storied past. Actually, it has been a pioneer in medical research, some groundbreaking programs, some of the pharmaceuticals that are essential in today's care, like Brilinta, or some of the medical devices like the implanted defibrillator. Those were products that were developed by clinicians here in partnership with others. And they're major medical advances that are used across this planet today. So Sinai Hospital has some very unique programs, programs that draw international acclaim and patients, such as our International Center for Limb Lengthening, where we have a very special group of orthopedic surgeons with unique expertise who focus on limb lengthening procedures, predominantly for people who have been born or have developed conditions where their limbs are of different length. We do essentially everything except for transplants here. And we have a lot of deep expertise in a variety of areas. The Krieger Eye Institute, for instance, provides exceptional care. We have significant graduate medical education programs, large numbers of residents who are trained in the final years of their medical education here. We have a pediatrics hospital, a neurosciences institute, deep experience not only in orthopedics and all of these other areas, but cancer, cardiology. So we're very much a dynamic healthcare center. And through our health system parent, which is LifeBridge, we also operate, a number of other hospitals in this greater marketplace.
You'll probably be pleased to know I was on a plane recently, and the person next door to me, well, fortunately she wasn't next door. The middle seat was still open, but she was in the window seat, was on her way to Sinai to visit her niece who was being treated for limb lengthening. And she was flying in from Texas. So you have quite a national reputation, not only in limb lengthening, but in many other areas as well.
Thank you for that. And our clinicians deserve those kinds of accolades. It's a real calling for them.
So, Dan, I know besides Sinai, as if running that institution were not enough, LifeBridge has recently taken over what is now known as Grace Medical. And I believe you're overseeing that. So that would be an entity for sure, I would think, that many of our viewers don't know enough about. Please feel free to share with us the story of Grace Medical and how it is providing wonderful services to the community.
Sure. Yeah, I mean, fortunately, I have a portfolio of services within LifeBridge that, gives me the privilege of not only running Sinai Hospital, but also Grace Medical Center. I have our portfolio of research and innovation, as well as graduate medical education. That's a mouthful. The Grace Medical Center, formerly Bon Secours, is a very special institution, and it is what I consider to be a real success story. Grace, at the time, Bon Secours was really at risk of failure and collapse because economically, the institution was not self-sustaining under the configuration that it was operating. Healthcare is a really challenging discipline to provide and sustain economically, as well as maintain some of the quality parameters. And so LifeBridge was invited to offer a proposal to continue operating the institution. Other very fine healthcare providers in this region were also invited to offer their considerations. And ultimately, LifeBridge was selected to be the owner-operator of what we now have renamed Grace Medical Center. Grace has a very strong history and value system that is rooted in a religious past. And it's important to us that we maintain the culture and the focus on the West Baltimore community, and that we celebrate, the past of Bon Secours. Clearly, Bon Secours was very, very dedicated to the community. And everything that we've seen demonstrates a sense of integrity and passion around the pursuit of healthcare for the West Baltimore community. The economies of scale that we're able to deliver and reformatting some of the way that healthcare is delivered enables us to provide care that is of the highest quality, care that's needed by the community, and care that is sustainable from an economic standpoint. So I can provide some examples
Please do.
So, as a full service hospital, previously Bon Secours had an ICU. But the average daily census in that intensive care unit was less than 2 people, certainly towards the end of its existence. And, to really staff up and have all of the equipment and expertise at the ready to provide ICU level service is not something that's sustainable for a patient population of less than 2 people a day. Considering, the nurses that you need, respiratory therapists, pharmacists, a bedside intensivist, intensive care, ICU doctor, there's no way to be able to produce highly reliable, high quality results in a way that's economically sustainable for that population. And there is adequate ICU level care around the facility, some of which we provide, some of which other healthcare providers have available. And so what was clear to us is that, there wasn't really this huge need for ICU level care. On the other hand, there were other forms of care that the institution could no longer provide because of its size and weakened condition. And so while we have removed ICU care, and we provide that through Sinai and Northwest, and it, certainly University of Maryland and Hopkins and others provide that care. We've brought other services back into the community, like orthopedics or vascular surgery, pediatrics, those sorts of things. And the community has received those services very, very well. A lot of what we're doing is based upon what we're hearing articulated by the community, what they want, what they need, what we can do to help fulfill those deficits.
It's really, I must say, very admirable to be going into underserved communities like that and offering them a chance to really upgrade the healthcare one by one of individual families. Kudos to you for that.
Thanks. Our organization is not for profit. We're mission driven, and it is a privilege to be able to serve people. And also understanding the inequity of care and opportunity, and being positioned to make a difference is among the most meaningful work that I could ever conceive of doing.
Yeah, no doubt about it. Thank you on behalf of all Baltimoreans. I guess I would be remiss, Dan, in talking to the CEO of a hospital in 2021 if I didn't ask about COVID and the effect that it's having on patient care. And I already know a number of my friends are very anxious to get on the list for your vaccines. I was told last night by one of your executives, your list is, I think, 65,000 people long as we speak. So just share with us the effect that COVID is having on the operations of Sinai and how it's affecting your daily life.
Sure. Well, 65,000 is so yesterday.
Oh,
because today it's now over 70,000, and we're accepting all comers. Right now, I guess the choke point is really the availability or lack thereof of vaccine, and so our goal is whatever vaccine we can source, we want to get into somebody's arm. We're being very, very cautious to follow the regulatory framework and the approved ethical framework for dispensing the medication. And this is a really interesting story because it is a representation of kind of the haves and the have-nots, the people who desperately want it, the people who have fear and good cause for skepticism based on issues of the past. And so on the one hand, we try and tell people we will get to you. We have you on the list. And then on the other hand, we're trying to inform and educate and assure that people have a comfort level with receiving the vaccine. There's those who want it, and they're putting a lot of pressure on to get it. There's those who don't want it, and they don't want to be pressured, if you will. We're trying to be respectful of everybody, and at the end of the day, our job is to try and assess the science behind this, and our subject matter experts have done that. And then to use those frameworks that I referenced, the regulatory rubric through the federal government and the state government, and the ethical framework that is promulgated by the bioethics committees. And I have to say, this comes at a time where we have significant competing work streams. Now, what do I mean by that? It is a pandemic. We are in the midst of a surge. And so we have, populations of COVID patients that we're trying to serve. These are patients who are come to us in addition to the normal conditions that we would see every day. We were designed as a healthcare system in this country to serve a population that was not considerate of a pandemic. So the number of personnel, the number of nurses, the number of ventilators, the number of hospital beds is considerate of, normally anticipated volumes of cancer patients and cardiac patients and so on and so forth. So there's a huge reliance on our workforce to care for not only the cancer patients and cardiac patients and all of the others, but in addition, this new load of COVID patients. That comes at the same time as testing. Sinai Hospital was among the first in this state to stand up COVID testing. And we're the only ones in our community who are providing that testing service. So we also have dedicated workforce to testing. When there was not an adequate supply of personal protective equipment like these masks, we used our innovation team and many of the thoughtful and hardworking personnel of our organization to create a factory. We partnered with Under Armour and others to actually design and craft personal protective equipment. That was also a huge draw on our workforce and, a huge need for workforce members. And we're doing the same with a variety of other things. There's something known as monoclonal antibodies. That is an infusion treatment that is given to patients in the early phase of infection with COVID. And so we've had to design a monoclonal antibody infusion clinic, which is currently something that we're in the process of designing, and we'll have to have workforce members in that area. There's a lot that is really impressive and things that should be celebrated, but overall, the impact of COVID here and across this country truly has been devastating. Right. The work effort on the part of these nurses and respiratory therapists and physicians and technicians, it's humbling, it's heroic, and it will have a lasting deleterious impact on this industry. And all I can say is, I draw great comfort and strength coming in every day and witnessing these acts of kindness and medical heroism.
Well, Dan, kudos to you and all the heroes in the healthcare world that you work with. We only have a minute left, but I wanted just to ask you, because I know in addition to all these high impact things you're working on, I know that you as an entity, Sinai, LifeBridge, et cetera, are very community oriented. And someone mentioned to me I should ask you about your mobile care vans that are in and around Baltimore. Just give me a quick answer on what is that all about as well.
Sure. We are constantly assessing our community to see what the needs are. So with COVID, for instance, what our pediatricians noticed was that children were not receiving their normal childhood immunizations for things like measles, mumps, rubella, so on and so forth. And so one of the innovative approaches that the team came up with was confiscating one of our vehicles here, reclaiming that as sort of a medical delivery, platform, putting our personnel and their supplies and equipment on that vehicle and sending them out to the community itself to meet the needs of the patient on their terms. And so we've been doing that with pediatric services. We've done it for frail elderly people who have comorbid conditions. And we're going to try to use that same platform to do vaccinating of certain fragile population members as well who won't be able to get to the mass vaccination sites. So that's the idea behind our new vehicle, and it's a work in process.
Well, Dan, thank you for being with us. Congratulations on all the immensely important work you're doing at Sinai, at Grace Medical, all of LifeBridge. Baltimore is indebted to you and your colleagues for their service. Thank you so much for being with us.
Thank you.